Well, thank you. A pleasure and an honor to be asked to be able to speak here at OLLI to all of you. Um, I think I've given this talk last week, an earlier version. I've updated a lot of it since then because everything is happening so fast in coronavirus. I've updated it, and we're going to be trying to answer three different questions during the hour and a half. This is the start of the slides, and uh, the main thing is going to be the last of the sessions. The last of the three sections is going to be the new CARE Act that was passed last week, and how can it save you $10,000 or more? A question that most people are interested in finding the answer to. This morning I got 43 slides. I'm going to do the current status of COVID-19 or coronavirus, or what I have used. I use C19 because if I keep spelling out coronavirus 19, it takes up all my slide space, and so I've abbreviated to C19. So the first will be on the status of where it is, where our country is, and where Florida is, and where our zip codes are. And then we're going to do about 12 slides on the stock market and the economy and how this is affecting both of them. And then the last section we're going to do is this new law that was just passed and signed into law last weekend that will get everybody some money. I've given this talk before. I may switch this a little bit. The following week, we're going to be doing that. Next week, we based a little bit on this next pandemic book down here. I hope you're seeing my arrow go around this. And then the week after, 2 weeks from now, we're going to be doing this book, Factfulness, which kind of tells us why the mental reasons why we are often wrong about things we think. And then for an example of that, I'll apply that to COVID-19 as the example. So again, the three comment periods. First, we're going to do the C19 status and are we getting it under control? And then the second, we'll be doing the stock market crash and the possible future. And the third thing we're going to be doing is the CARES Act and saving yourself $10,000. So let me get on to here. Well, this starts with where we are today in this whole thing. I thought what would be very interesting is to compare COVID-19 to the normal annual flu. And so what I got is I've got the information for the last 7 flu seasons that where you could get information. And then I've averaged them, and then I've divided them by the population to come up with the number of people. So what you see here is in 2010, 2011, 21 million people were estimated to have gotten the flu, that year's flu. And the next year, 9,300,000 were estimated. And so on, the flu is, sometimes it's stronger, sometimes it's weaker, but what these 7 years average, they average 25 million people per year come down with the flu. And then you divide that by the population in the United States of 330 million people, and you come up with, you get 76,000 out of a million people come down with the flu on an average each year, or 7.6%. You could say it either way, but 76,000 out of each million. So if you think of Pinellas County as having roughly 1 million people in it, that's saying that on an average year, 76,000 people in Pinellas County come down with a flu. And then you come over to this next column, and well, this is the number that are go in and get a medical visit, go see their doctor about it. And you see about 12 million people per year, or 36,000 per million, 3.6%. Go and see their doctor on the flu each year. And out of that, how many wind up become hospitalized? Well, it turns out that 390,000 people a year wind up in the hospital because of the flu, and that's a rate of 1,200 per million. So in Pinellas County, you would expect 1,200 people to be admitted in the county on an average year for flu. And then this final one, and I'm not sure, mine's being blocked a little bit by my my screen, but I think you can see this. This is the deaths. In a typical year, 35,000 people in the United States die from a flu, as partly because of the flu, or maybe they have multiple things, and that's 106 people per million. So again, looking at Pinellas County, you would say 100 people per year die in Pinellas County because of the standard flu. Now we're going to compare that with what this coronavirus is doing so far. So this is as of last night, and these are so we're looking here. We've got about 1,000 cases per million. This is the USA total, and this is the total number of cases, 330,000 as of last night in the United States. And you divide that by 330 million people, and you come up with 1,000 people per million have already caught it and been identified with it. The problem is it's a hard thing to identify without tests, and the tests are complex, and they just don't have enough tests to go around. So a part of the problem is this number could be very low. It could be 1/10 to 1/100th. There could be, while it's saying 1,000 people per million, it could actually be 10,000 people per million, or it might even be 100,000 people per million. Nobody knows. Of course, we do know the deaths per million, and that's running at 29 right now. There's a total of roughly 10,000 people have died so far, and divide that by 3 by the population, you get this. And then okay, so that's the average for the United States. Now let's go down here and look at Florida and see how Florida is doing. Well, Florida, actually, the average is 1,000 people per million, and Florida is running about 60% of that, 590. And the deaths per million, we're we got 29 here, and we're down in Florida is lower. Well, that's possible because, I mean, you could say that possibly is because Florida is taking more action, but I'm not sure that's true. Or you could say that the flu doesn't survive as well, which is what I think is happening. The flu does not survive well over 75 degrees Fahrenheit, and the flu does not survive well in high humidity areas, from what I've been able to read. And consequently, the survivability of the flu, and therefore the transmissibility of the flu in Florida, may be lower than most of these other states or northern states where the temperature is at this time of year is colder, and where inside the house, because you're heating the air with a furnace inside the house, it's much drier, so you have a much lower humidity, which allows the flu to survive better, and you have lower temperatures, which allow the flu to survive better. So that could, nobody knows this. What I've found is nobody knows this. Everybody debates every single point that you put out, but this is a possible explanation of what's going on. Now, this graph I thought was interesting because what I did is I took, as of last night, I took all of the confirmed cases. And the reason I underline confirmed is, again, there's no test. It could easily be that we're only picking up 1 out of every 10 people. And it could be that we're picking up only 1 out of 100 people that have caught this disease. It could be a lot of people. It's a relatively minor effect too. We just simply do not know. But of the ones that have been confirmed by a test, this is the number of confirmed cases per million and by country. So what I did is this dashed line. If you remember back 2 charts ago or 2 slides ago, I said the average flu in the United States generates 1,200 flu cases per million population. And so that's what this dashed line is. And then you look at how is that relative to these other countries? Well, you do see Spain is unfortunately in quite a bit of trouble, and you see the U.S. is approaching that number. Now we're in the beginning of this, or maybe we're approaching the peak of the season of this particular COVID-19. So it's hard to know where we are. This dashed line is after the fact. It's after 2 years after the fact, when CDC has sat down and determined who they think, how many cases they think there really was, and all of that. Whereas this is the real life as of the moment. We don't know if we're measuring it right or not yet. And you can already see that just in COVID-19 that we're already approaching the number of people who CDC would believe on an average year would get the flu. But it's not a horrible number, but we also don't know if we're counting them right, and it could be 10 times that number. And we do see that these other countries, Spain, Italy, Switzerland's is a really surprise to me, but you see these other countries have a much higher rate right now. And then this is the deaths per million. And again, I put the dashed line in here at 106, which is the typical 106 people per million on a typical flu season died because of ramifications from the flu. And you see already Spain and Italy has gone well over that number. You see the US is still at this moment way down, although we haven't gone through the season yet. And but it kind of puts, you know, it's hard to get your hands around this thing. There's so much scare to the whole thing and so much hype to the whole thing. It's hard to get your hands around just how bad this really is. On these particular charts, when I plotted these out, it surprised me in that it's saying, almost is saying to me that it's not as devastating as some of the scare tactics are. I have kind of in my own mind thought of it as this is kind of like 10 times the normal flu season. If you think back over the last 10 years, everybody in your family and friends and yourself who have come down with a flu in the last 10 years, and the number of those who had to be hospitalized, you got a rough idea of how serious this is. It's not good at all, but it might not be the end of the world, is I guess what I'm saying. And it could be, but it also might not be the end of the world. Now this one is showing this. The important thing here is these are total cases, and this is United States, and this is the days of the week, or you know, each day is plotted as 1 point, and this is the cumulative number of cases. And it is plotted on what is called a logarithmic scale up here. And a logarithmic scale goes from 1 to 10 to 100 to 1,000 to 10,000 to 100,000. Engineers love logarithmic scales. It shows the relative rate of increase. Whereas if you look at this on what's called a linear scale, rather than a logarithmic scale, it just looks like a hockey stick. It looks like everything is going through the roof. And the reason this is important is that before any action is taken and the disease is taking its normal course, it grows at a certain exponential rate, which is this dashed line right here. And then what you see is, as a result of people self-quarantining and social distancing and everything, you're seeing this curve start to come off, which is a very good sign. And if I had to make a wild guess, I would say it's going to approach and stop at about 1 million. Now, let's look at what happened over in China. This is China, this middle chart, and this shows the same, again on a logarithmic scale up here. It shows the number of cases and the rapid increases in cases in the Wuhan area of China. And then what you see is the quarantine going into effect. And then you see a little problem here where they weren't measuring quite right. but you see it approaches, and they peaked out at 10,000. So can you see from this curve right here why I'm a little bit optimistic over here, that it's starting to do that bend off and flatten out? Doesn't mean it won't come back a second time. It doesn't mean that everybody won't get tired of being in quarantine and go back out, and the thing will peak right up again. But this is promising. Then what you see over on this last chart is you see the deaths, and you see on the deaths, you see that what's happening is it hasn't yet gone over. Well, the reason it hasn't really started to do this kind of a flattening over here is that this is when you catch it and you're identified as having got it. It really takes a week or 2 weeks or 3 weeks. Most hospitalizations are 2 or 3 weeks. And so you've got to stop hospitalizing people if you want to have much of an impact on deaths. And so naturally, the flattening of the death curve is going to trail the flattening of the case curve by 1 or 2 or 3 weeks. And then we have the problem of we don't have adequate testing. And without adequate testing, we don't know how many cases we really are. And that makes the hospitalization rate per million and the death rate all uncertain. I mean, the death rate, but the hospitalization rate, the hospitalization rate, I guess you do know, but you don't know how many cases you have because you aren't testing properly. So this is just an example of 2 different countries. Germany has the test, and so they're testing people who have the severe disease and have been hospitalized or moderate, and they know about how many fit into each of these categories. Whereas over in United Kingdom, you see that they're only able to test the people that went into the hospital, and so they don't know how big this group is. And then when you divide the death rates by the confirmed rates in Germany, you get a 1.3 death rate, a 1% death rate. When you divide the deaths by the number of confirmed cases in the UK, you get almost a 9% death rate, when in fact probably the death rates are identical. It's a measurement problem, it's a testing problem. So how are we going to solve the test problem? Well, last weekend, the FDA approved this, I guess it was last Friday, a week ago Friday, approved this 5-minute test for C19. Abbott, also earlier known as Abbott Lab, is a company that my son used to work for up until we worked for last year. And then he joined a startup. He was in research for these guys, and I was talking with him about this test, and he says that these guys are their test crew is their diagnostic crew is very good at Abbott Lab. Abbott Lab has 107,000 employees, and they're built this little machine right here, which is the size of a toaster, and this little trap door here is where you stick in the sample. And so you draw a sample, and you within 5 minutes you can tell whether or not, if the person has COVID-19, within 5 minutes you can identify it. If they do not have it, it takes about 13 minutes, because you got to, I don't want to go into the science of it, but you got to let them multiply more to make sure that there isn't a low level of the virus present, and that if there's a high present, you get the reading much more rapidly than if there's a low present or none. And this device has been around for years. It's been used for influenza A and B and strep, and so this is a known device. What is new is the test. And Abbott says they can do 5 million of these a month, and what they really need to do is 330 million of a month to test everybody in United States at least once a month. But so be it. It's the first time we can test, so that the testing should be better. And then, are there any drugs? Well, there does appear to be. The FDA approved 2 malaria drugs to treat C19, and this can help an effective drug reduces the overload on the medical system, which is the real scary part. I mean, it's scary enough if you come down with a virus, but you may or may not be hit badly with it. If you hit badly with it, you have in the back of your mind, well, I'm going to go to the hospital and be treated by this world-class medical team. Yeah, that is true today, but it's not true in New York City. And what happens is eventually so many people show up that they overload the system. And so what you need is you need drugs that will make people better, faster, keep them out of the hospital. And that, of course, because it's a new disease, those drugs do not exist. So they have found that some malaria drugs seem to work. These two malaria drugs, and they think they partly block the replication of the RNA. So that's how the virus is not, unlike a bacteria, a virus is not alive. It's a string of DNA that goes into the cell, hijacks the cell's mechanisms to make more copies of itself. And it makes so many copies of itself that eventually the cell blows apart and releases the virus, which then goes around and affects all the adjacent cells. That's what makes a virus. It's not a living thing. It's a near living thing, but it's not a living thing. So what makes these two drugs promising? Well, there was a trial in France where they used it on 80 patients where they used HC and AZ, and they found a very good results in treating it. And then there was another study, again from France, which tested it on people who were in more severe conditions in the hospital, and it found it did not help them out. So I was talking last night. I have a very good friend who's a medical doctor at Mass General and also a professor at Harvard Medical. And I was saying to him, what he thought about this? And he says, I think that is working because of what those drugs are prescribed for. He says, I think what they're doing is they are controlling your immune system's response to the C19. And he used the example, and I thought this was a great example. You know how most of us can be stung by a bee and it stings, but you know we're fine. It just stings and it itches. But somebody who has, some people go into shock. Well, the shock is not from the bee sting or the poison from the bee sting. The shock is from your immune system's reaction to it, and that your immune system is overreacting to the bee sting. So people who need a immediate treatment for a bee sting are people whose immune system are overreacting to it. And he said this is the same thing that's happening with C19, that what's happening is some people overreact. Their immune system their immune system goes into a overload, and it's your immune system that is giving you so much trouble and that you can actually die from. I mean, the same way you can die from a bee sting. Your immune system has just gone crazy. And what this drug does is it slows down your immune system's reaction. So for whatever it's worth, people are still, you know, we've got to find some drugs for this thing. And then, so this is Pinellas County as of noon yesterday. And this is the number of cases there are by zip code, color coded. Basically, the darker the color, the more heavy the caseload is. And I think what you see right here, I think this is Eckerd College here. And then this is zip code, this is the one I'm in, 33711. And it's black because there are no cases have been reported. Nobody has gone, and nobody has a confirmed case that has a home that has that zip code. And apparently there must be one or more from the Eckerd College zip code. And then this is the county, so you get kind of an impression of how it's spreading in the county. My quick guess is at least around the the Eckerd College area, including the beach area over here, is not too bad yet. And we've got 318 residents of Pinellas County out of our million people who have been tested as positive. I'm almost ready here for a break. Let me check my time. Yeah, I need a break. So this is CDC's hospitalization rate. This is important for particularly older people to pay attention to. Your hospitalization rate, if you have caught it, but you have none of these pre-existing conditions, about 9% wind up in the hospital. If you have one of these pre-existing conditions and you catch C19, about 44% wind up in the hospital, or about 5 times as often. This means that if you have one of these pre-existing conditions, you should be in deep quarantine right now and be serious about it. It doesn't mean the rest of us don't have an issue. It just means the people that have a pre-existing condition, including smoking, have 5 times the rate of winding up in the hospital. And that I would be 5 times as careful. Now, the vaccine, we all get the flu shot every year. And the flu shot, what's the flu shot for? Well, the flu shot tends to be for last year's flu with some educated guesses of how it might mutate this year. And that's what our standard flu shot is. This is a brand new version, and we don't have it. So how does vaccines work? Well, this is back in the 50s and the 60s before they had the measles shot. And look, we had 500,000 cases of measles each year, and 500 people died from measles every year. And then the measles vaccine gets introduced in 1963, and it takes a couple years for everybody to get on the bandwagon and join it. And then there's no more measles and no more deaths from measles. So how long is it going to take us to the C19 vaccine? Well, 18 months is the best I can see. I read the various things. I was hoping for 6 months and using another technique, but it just doesn't look it. Vaccines can be dangerous. You're giving a weakened version of the virus. In some kinds of vaccines, you're giving a weakened version of the virus into your body so that your body will build the antibodies for it. And you've got to go through step approval, first 100 people, then 1,000, then 10,000, then 100,000, and see what kind of reaction. There just is no way to do this fast. And approval for a new vaccine normally takes a decade. And yeah, with a real rush, maybe we can get it on in 18 months, but that's a long time. So I am open for anybody who wants to discuss what is our C19 status and what's our hope for getting this under control soon.
I have one from earlier, and this was when you were going over statistics. We had a comment question that says, isn't the only reliable statistic the number of deaths? You don't find what you don't test for.
Correct. Well, even the number of deaths. I mean, various countries, because of the high economic impact that we're going to go over in the next section, various countries have wanted to decrease and not report deaths, because if you're a tourist-based country, many countries, including Spain or tourist-based countries, if you start reporting a lot of deaths, so if you can report it, if you're you have diabetes and you also have C19, and the C19 aggravates the situation to the point where you die, how is that going to be reported? Are you going to be encouraged to put it as a death from diabetes, or are you going to put it down as a death from coronavirus. I don't know. I have some suspicions that even the deaf ones may be adjusted up later because of that. Thank you for the question.
And we have another thank you for doing this presentation. And then can I ask you to explain why the virus favors cold temperatures and low humidity? To my non-scientific brain, I would think that the virus would benefit from warm temperatures.
Yes, and so wouldn't I. Okay, so here is my, you're talking to an engineer, not a medical doctor. So everything that I do is an engineering approach to it. So what I see is you breathe in air, it goes into a lung, your lung is moist, you breathe out your air. Along with the breathing out, you have little tiny aerosol particles of moisture. Now, so if you've ever seen anybody, if you've ever been up north and you've been in a cold climate, you can see your breath come out. That's the little air particles or the moisture particles coming out. Now, the virus is not alive. The virus can last a fair amount of time as just a strand of DNA or RNA. But so it's in your lungs, it's in the infected person's lungs. They breathe it out. It comes out as an aerosol particle. I'm not talking about a cough particle. I'm talking about a breathing out aerosol particle. And now it's floating around in a 6-foot radius around. If you are in a warm environment like Florida, the evaporation rate of those particles is much more rapid, which means that the particle evaporates more quickly and the virus falls to the ground. Okay, so why wouldn't a high humidity area like Florida, why wouldn't that slow down the evaporation of the particle? Well, I can't explain that either. I was thinking, this is a true story. I was thinking of switching my air conditioner, which I have control of both temperature and humidity. I was thinking of switching it to a lower humidity would be safer. But then I read an article that looked like it was well researched. It had 7 reference articles to it that said that this is a particular virus that does not do well in moist climates, even though there are other influenzas that do well, or that do survive well in moist climates. So that's kind of where I was coming from. That was kind of how I was trying to answer that question. I hope that was helpful. Thank you.
And just one more a clarification says, are different reactions to C19, whether it's mild, moderate, or severe, is a function of our underlying health, not that there are different types of C19 that exists?
Well, I think our underlying health, and these, you should have a medical doctor doing this portion of the presentation or answering these questions. But yes, what I think is happening is it's the same C19. I think there are 2 different things that can get you into trouble. One is if your immune system overreacts to it, and you kind of have an immune system overreaction. That's one of the problems that you can get into, and that's where this malaria repurposed malaria pill slows down your immune system's reaction. Then alternatively, if you have a pre-existing condition, let me give you one clear example would be you're under chemotherapy for cancer. Your immune system has been wrecked by the chemotherapy, and now you're highly susceptible to everything, and you're at much higher risk than you would be. Then you go somewhere in between that with all the other ones. Smoking, because you got smoke particles and you got, your lungs have been injured by the smoking. I think I'm sorry about not looking at this from a medical standpoint, more from a common sense standpoint. or more of an engineering standpoint, but I think you can kind of imagine why each of the various diseases increase your risk.
And that if anybody has any follow-up questions, please feel free to use the chat for that. We do have one now that says, how can we get the testing to be more widespread?
All I can hope, there are 9 different companies that have an FDA-approved test of some sort or other. FDA is under a lot of pressure from Washington to approve these things and make it look like something is happening out there in the real world. The one that is done by Abbott, I checked out with my son, and I do know that process. Basically, it's a DNA-based test, which is the kind of the gold standard, and that one looks good. The problem is that they can only make 5 million tests. You know, they're only geared up from 0 to 5 million tests per month is pretty darn good. But I guess if I thought it would help, I would, and I were in Washington, I would tell them, this is a Manhattan project. Do whatever it takes to build these things 10 times faster and get 10 times as many tests out there. That I think would be a Washington maneuver that would have an impact. So section 2 is the economic and stock market reaction to date, and I'm gonna try to pick this up faster. This is from my 55 years of investing in the stock market, and this is how I'm reading the impact on our economy going forward. But I know the last section is going to be more important, more useful to most people, so I'm going to go through this fast. Okay, stock market has been in a roller coaster in the past couple of weeks, and the disclosure I didn't want to put out here is I know nothing. Contact your financial advisor. Do not base anything on my advice here today. So let's look at our job loss. This is the job loss here in the United States between February and March, and you see that the hospitality and leisure industry been decimated. Hotels, cruise lines, airlines, all that stuff. And you see the other industries have been hit. And there's been quite a few job loss, and it's just starting. I'm sure that next month is going to be far worse. And then, so what's happening in the stock market? Well, what I always like to look at it long term here. And so this is the bottom of the market back in March 2009. And this is how the market, and this is the market's climb from a low of about 65 to a high of about 340 over a 11-year period. This has been a remarkable up climb. You rarely see this in the stock market, a curve that stays within that so well. What is new is this area right here, and let me see if I can blow that up. What you see is right over here. You see it breaking this long-term uptrend line that I have, and that is not a good sign. That puts us into a bear market. And then you see this green line that I've shown that is really kind of a prior top. A prior top turns into a support level. So, you know, for what it's worth, it's not worth a lot. Anyhow, it's down 39% or 36%. And then this was this is an 11-year chart. This is a 2-month chart, and this is each of the bars is a 30-minute. This is a 30-minute chart over here. And what you see is this is in February while the market was still moving along nicely and was up around 340. For those who really, so the SPY is the Standard & Poor's index as it's traded. Anyhow, a bear market is normally when a stock market goes down 20%, and that would be this line right here. So when it broke this line, which it did right here, then the market switches from a bull market into a bear market, and it comes down. and then it continues down, and it goes down about 35% in 32 days. In 55 years, I have never seen a market go down so fast. Then what you see, and then I've drawn these lines in here are the trend lines going down. And then you see on March 24th, it broke out of that downtrend and it came up, did a couple tops, and now it was over here. And this morning, when I was looking at a pre-market, it was up about here. It still hadn't broken this green line here. Now over here, hidden by mine, I'll see if I can get to that. Gotta move my face. Okay, over here, you see what happened in prior. So the question that you have is this the end of the bear market and the start of a bull market, which means you should get back in and start investing again. And the answer is nobody knows, and anybody who tells you they know, don't believe. But what are the signs and what are the probabilities? That's the best you can go on. And what you see over here is for the past 2 decades, you see bear market bounces. You see one occurred in April of 2001. For 47 days, it went up and it did a 19% advance. And then the bear market continued. And you see 5 of those happened. On an average, they took 47 days, and on average, they went up 20%, and then they turned around and continued the bear market. So that would say this is just a bull market rally within a bear market. But then you look at just recently at what they had, the Christmas of 2018 was the bottom of the market. And what you see then is in 87 days, it had gone up 25%. Yes, then for the next 22 days, it went down so that it was up only 16% over its Christmas low. And then it continued to go up to so that by after 290 days, it was up 45%. So you would have wanted to be in that whole rally. And the question is, which is that? Is this current one? Is it this situation or is it this situation? And we do not know. So the question is, was March 14th a breakout that's investable? Okay, and now this is a fear index, and I don't have time to go into this, but this is a measurement. It's a statistical measurement of standard deviation, but it indicates how much fear there is in the market. And this is you had very little fear down here. It was at a 15 and had been going flat that way all the way through to about March 20th, 21st. And then suddenly the market started to get scared of coronavirus, and it got more and more and more and more scared until it hit a very high peak here. And then it started to come back down again. And the question is does this as fear comes down, people get back into the stock market and the stock market goes back up. So again, we look down here on March 23rd, 24th, we see the fear is dropping. Then it comes back up and now it's dropping again. This morning it's down in here. So this is an indication that the fear is going down, and which would mean that the market has a more of an ability to go up. And finally, this is a put call ratio. I'm going to skip over what the puts are options to that pay off when the stock goes down. Calls are stock options that pay off when things go up. And you put a ratio between the two, and when it peaks like this, it becomes a buy signal. When it comes to the bottom, it becomes a sell signal. And so this is saying that maybe the market has peaked, but we don't know if this is going to turn and go back up even further. This is the stock market right here. So you see that it gave a sell signal back here, which was pretty well timed, and now it's giving a buy signal that may or may not be well timed. We'll know. So this is the net result that you should be taking out of this. If the SPY, if the Standard & Poor 500 is greater than 265 and the VIX index is less than 50 and the put call ratio is down, should you buy more? and the cartoon says, "Hey, aren't you that guy from OLLI who said to buy the SPY at 265 when and the VIX at less than 50?" So anyhow, so then I went out and I found a bunch of experts yesterday that were all checked. And what are they saying? What are the experts? The experts in the stock market it's a very relative term. 22% predicted that the low occurred on March 23rd, that we already put in the low. 78% of them said the low is going to occur sometime in the future, with June 7th being the best guess. So 1 out of 4 is saying the low is already in. 3 out of 4 are saying that we're going to have further lows. And the stock market should, in fact, be based on where the economy is going to be in 6 months to a year. That's really what you should be investing for, not where it is today. And so what happens after we post C-19 panic? Well, this is McKinsey, which is a very reputable firm, surveying 1,000 people over in China. I think it was 1,200 people over in China. And this is a month ago, they surveyed them, and 44% were optimistic the economy would rebound within 2 to 3 months. And now that's increased to 48%. And 55% were saying that the market would be neutral, that it wouldn't be up or down. And that's decreased to 45%. But here's a surprise. Only 1% a month ago said the market, they were pessimistic and thought that it could have a long-term impact on the economy, and that has increased to 6%. So deep fear has increased, mild fear has decreased, is the way I would read that. And so then the question is, and this is the question in Washington, it's the question in Beijing, it's the question all around the world, the economies are. And it's the question, if you're running for office, this is the real question. Must we choose between saving lives or saving the economy? And it depends on the politician which way you decide to go on this thing. So one way we could have both, saving lives and saving the economy, is if we issued green cards to people who had already got the coronavirus and had recovered in 7 days after the recovery, so that you're sure they're not contagious. Or you could have it free movement of anybody who had passed a C-19 test, like the Abbott test, or had got a vaccine, which doesn't currently exist. And then you could have free movement of that group. They could go back to work, they could go out and shop in the stores, they could do anything. You just have to have periodic retesting so that if they did come down with something later, that they are pulled out of the free group and they lose their green card. Quarantine everybody else. And under this basis, the historic typhoid Mary would have been quarantined. She was not sick with typhoid. She was a carrier of typhoid because she had the immunity system that for some reason prevented her from getting it. But this method would have picked up that she was a carrier even though she was not sick. But then the question is, how are you going to test 330 million people weekly or even monthly or annually? How are you going to pull this kind of a system off? But if we could figure out some way to do this, if we had some quick test to test people, and only those people would self-quarantine or be mandatory quarantine if you had it or you weren't sure, and let the other people go back to work, you might be able to save the economy. Otherwise, the economy's in trouble. But this is good. This next section is the good part. Okay, I don't get any questions, so I'm going to go on to the new law that was passed last week. It's called the CARES Act for Coronavirus Aid, Relief, and Economic Security Act. And the question I'm trying to answer in this section is, how could this new act save you $10,000 plus? And it can. It's there. I'll show not everybody, in fact, relatively few people, but I'll show you how it can save substantial amounts of money. So the first thing the CARE Act does, and you probably already have heard about this, is they'll be mailing out individual recovery checks to everybody. And my next slide will go into exactly how much you'll get, but they're going to be mailing that out in about 2 weeks. And then there is, if you are, as most of the ASPEC members are, if you're retired and you have a required minimum distribution that you must take from your IRA or your 401k or 403 or your 457, if you're forced to take that money and you're taxed in that money as you take it, but you don't really want to take it because you don't really need it, in 2020, you're allowed to not take your minimum required distribution, which is the trick for those people that are saving $10,000. But this is good for everybody, including people that are not yet retired. You can withdraw from your retirement plans where the penalties are waived. Normally, you have to pay a 10% penalty if you're under 59 and a half. And you got to pay taxes. The penalties are waived and the taxes can be owned. So if you're out of a job and you need somebody, says my internet connection is unstable. I don't know what that is. Okay. Then the amount that you can borrow from your retirement plan, the limits have been increased to $100,000. And if you have a student loan, the student loan relief waives the student loans. You can do that. Or if you want to start a business, the SBA loans are available on easy terms. So those are the main aspects of this new CARES Act. A $2 trillion package. $2 trillion is a lot of money. There truly is a lot of money. There are probably 50 million tax returns in the United States that pay 97% of the taxes. So you divide 50 million into 2 trillion, if I can do that in my head, I think that's $40,000 per tax return has been given away by the government. So those 50 million tax returns that pay most of the money, sooner or later, it got to pay back that money. So here's the rules on the stimulus. So $1,200 to most adults with a Social Security number, even if you don't have an income, retired, non-retired, non-working, unemployed, everybody gets about $1,200 for the most part. There's some restrictions. Okay, you get an additional $500 for each child on your tax return who is under the age 17. And then you get zero income. The cap is if you're an individual and your income exceeds $99,000, or if you're married filing jointly and you exceed $198,000, that $1,200 goes to zero. And if you're over 17 and you're listed as dependent on somebody else's tax return, you don't get anything. So this excludes all the college students. In fact, it excludes a surprising number of people. It excludes 21 million people who are over 17, but they're listed on somebody else's tax return as a dependent. They are going to get zero. It phases out for individuals starting at 75,000. If your income exceeds 75,000, at 75,000, you still get the full 1,200. At 99,000, you get zero. And in between those two numbers, it gradually phases out. So if you were halfway in between the two, you would get $600. This head of the households is 12,500 to something. I think probably 149,000. Couldn't get that number. And if you're married, it starts phasing out at $150,000 and it's at zero at $198,000. The payments will start on April 15th. It'll probably be first sent to those people who have already filed their 2019 tax return, and then it'll probably be sent to those people who have not yet filed their 2019 tax return. And that means that if you send in your 2019 tax return in the next week or two, you might well get into that first group. But they'll probably send out. True, there's a lot of people. This is probably 300 million people. Well, not that many because a lot of kids, but certainly 200 million checks are going to go out. But they have the ability to print those fast. Now, here is a surprise to this whole thing. This is not really based on your 2009. The check you're going to receive is based on either your 2019 tax return, adjusted gross income, if you filed that return and they have that, or it's going to be based on your 2018 adjusted gross income if they don't have your 2019 one. But that's only the preliminary amount. The actual payment is going to be based on your 2020 income. So that if your 2020 income goes down a lot because you've lost your job, the check you receive could be less than what you're going to get when you file your 2020 tax return, probably around April 2021. So this is just a refresher here. What is the stimulus check? It's money the federal government is sending to the taxpayer. I got this. This is supposed to be a joke. I got this out of a joke book. Where did the government get this money? Well, it came from the taxpayers and going to the taxpayers. What's the purpose of the payment? The plan is to let you go take the money and go out and buy a high definition TV or a new iPad, thus stimulating the economy. Well, isn't that stimulating the economy of China rather than the US? Next question, please. Games people could play. Well, let's say your adjusted gross income is high in 2019. It's going to go lower in 2020. But you want to get the maximum check right now, you could, and it's going to go lower because you aren't taking your required minimum distribution. You could delay sending in your tax return until I think there was a 3-month extension. So April, May, June, maybe it's July 15th is now the new extension. You could delay sending in your 2019 tax return, in which case your check's going to be based on your 2018 income. And that's one thing you could do. If your 2020 income exceeds this threshold up here, 150,000 for married filing jointly, 75 for individuals. If it exceeds it, you probably are not going to be asked to pay it back. So you could, if you wanted to play a game here, you could, if your income is below the threshold in 2018, delay filing your 2019 one. If your 2018 one exceeds the threshold, but your 2019 does not because of whatever reasons, then quickly file your 2019 because then your check's going to be based on your 2019. And the final check, which is really based on 2020, if it exceeds these thresholds, you're not going to pay it back. I don't make these rules up. I'm just quoting the rules. So how would you, if you are retired and you are getting monthly checks like we do from your required minimum distribution, and you're using that for your month-to-month expenses, how do you pull this all off? Well, what you're trying to do is you're trying to do this. You're trying to take income that you would have been taxed on if your adjusted gross income is over $85,000. You are going to be taxed at a 22% rate. If it's over 163,000, you're going to be taxed at a 24% rate. If it's over 207,000, you'll be taxed at a 32% rate. What you're trying to do is you're trying to move income that would have been in this range or in this range. You're trying to move it down into this range, which is a 10 or 12% tax rate. An example, this is not my example. This is an example I fed into TurboTax just to see how this is all going to play out. You could save $7,600. And why did I pick 7,600? Well, I was shooting for a $10,000 savings, and I already got 2,400 by my checks, my stimulus checks. So I had to get another $7,600 by delaying my required minimum distribution. So what I did is I said, well, okay, let's say that with the minimum required, or with the required minimum distribution, my 2020 taxable income would have exceeded 75,000. And let's say that I can hold back 35,000 of that by not taking my 2000, by using this rule that allows me not to take my required minimum distribution in 2020. And how am I going to do that? Well, that 35,000, I've got to have savings somewhere else. Otherwise, you starve to death. But you know what I mean? But if you have savings somewhere else, you use your other savings for the 2020. This eliminates that 22% tax on 35,000, which is a $7,600 savings. And then you just go back to the required minimum distribution in 2021, and that savings remains. But in this particular example, if you actually go through those particular numbers and you feed them all into Quicken, and the remaining part, the other part of your income is coming, some or all, from Social Security and pensions. There's a funny way that Social Security is taxed, and by having done this, you save another $4,200 in Social Security taxes on your Social Security income. So your total tax savings in this particular example is almost $12,000, and then you got another $2,000 that you're getting from the stimulus. The trick is that you need to act fast, because if you are, like most people, having your required minimum distribution paid to you automatically on a monthly basis, you've already got January, February, and March's payments. And with speed, you could go in and you can cancel, and I've done that. I've canceled it on our accounts. You can go in and cancel the April through December payments. It is possible in an IRA to repay the last 60 days of what you've already received, but it's difficult and I don't recommend it. So that's how you could how you could use this act to save a bunch of money. And then a number of people over at ASPEC, they, again, because they have enough income coming in from whatever source it is, that they contribute a part of their IRA's required minimum distribution. They don't want it. They don't need it. They don't want it. And so they contribute it directly to charity, like Eckerd College. And so the money goes straight from their IRA, what would have been their required minimum distribution, goes straight to a charity like Eckerd College, using a thing called a qualified charity distribution, which is permitted under the IRS rules. And if you're doing that, the money that you're already not being taxed on that money. So it doesn't do you any good to not, you can't be not taxed twice by not taking it. But there is a trick here that if you were to do a qualified charity trust, and I know these are sound like crazy numbers, but let's say $10,000. Say you give Eckerd College $10,000 out of this, and you're planning, and you do that every year, or 1,000 or 10,000 or whatever you give. You're planning to do that every year out of your qualified using a qualified charity distribution. What you can do is delay the 2020 payment into 2021, and then take that minimum required distribution, which you now would have had to take, but now it's waived this year, so you don't take that either. And now in 2021, you on January 2nd, 2021, you make essentially a double payment, or you make up for your skipped 2020 payment, and that can save you lots of money. I know it doesn't apply to a lot of people, but those people that applied to were very, very appreciative when I showed them how to do this. Now, here's another thing that the new law allows. You can borrow up to $100,000 from your IRA or your, I assume from your 401k or your 403b or your 457 or whatever. You can borrow up to $100,000 tax-free for 3 years. So there's two ways you can borrow it tax-free and then repay it 3 years just slightly less than 3 years after you borrow it. That way you've got used to that $100,000 and you didn't have to pay any taxes on it, and you didn't have to pay any penalties for having withdrawn it. Or you can keep it, in which case you do have to pay taxes on it. But there is a rule that if you keep it and you know you're going to keep it, then you can pay, instead of paying the taxes, the $100,000 in on year 3, you can say I'm going to pay for 1/3 of that this year, 1/3 of it in 2021, and 1/3 of it in 2022. Or if you own and operate a business that's been closed or shut down or had reduced hours because of this, you can draw this money out. And the penalties are going to be waived for withdrawing it this year only. And normally those penalties are 10% early penalties plus a 20% withholding tax, and those are all waived this year. As I said, you can if you decide you're going to keep that $10,000 or that whatever 1,000, 10,000, 100,000, whatever you decide to draw out, if you decide that you're going to keep it, you're going to have to pay taxes on it, but you can pay them over a 3-year period. Or you can recontribute within 3 years, in which case they consider it a wash and there's no taxes and there's no penalty for having borrowed that money for 3 years. Student loans, if you have a federal student loan, you can go to your borrower. Generally, you borrow that from a bank. A local bank is the person who is holding your student loan. You just go to them and say, I want to suspend my monthly payments without penalty. Now you're going to have to pay it. This is not a gift. You're going to have to pay this back plus the interest. But if you've lost a job or whatever, you can do this for 2. And I don't think you have to lose a job or catch C-19. You can just go to your bank and say, I want to take advantage of this, and you don't have to. You get the waiver through payments that would have otherwise been due through September 30th of this year. Students with a Pell Grant can retain their Pell Grant that they've gotten this year, even though they had to leave school due to the closures. And everybody has got an extension for both filing their taxes and for making their IRA contributions for last year, and for paying their taxes without penalty. They have until July 15th instead of April 15th. And so who is eligible for all this stuff? Well, any individual who's been diagnosed with C-19, who a test that's been approved by the CDC, or if your spouse or dependent has been diagnosed, you can take this loan. Or anybody who has suffered a financial consequences as a result of quarantine, employment, furlough, layoffs, reduced hours, or cannot work because of a lack of childcare as a result of the coronavirus. So my guess is that most people can squeak in with some real or fabricated reason why they qualify for a withdrawal if you really do need this money. I'm not personally, I wouldn't do it. But then again, I don't have the need for it. If you have the need for it, it's a way to do it. Anyone who experiences a financial loss in an individually owned or operated business, they can withdraw this up to $100,000. And then there's additional benefits for businesses, for mortgages, and the student loans we've already talked to. SBA will loan you up to $10 million for 10 years at 4%. And they don't require any collateral, which normally SBA does. And they don't require any guarantees, which SBA normally does. It's much friendlier than the normal SBA loan program. And they are potentially 100% forgivable. So if your business doesn't turn out, and you go bankrupt, your business goes bankrupt, apparently they will forgive it all. Whereas normally the SBA goes after your house and your cars and everything. Employers don't have to get a refundable tax credit for the 6.2% employers share their Social Security tax, and they also can defer payment on that. And unemployment compensation benefits of $600 a week for up to 4 months, even if the employees are not eligible for state. Where does this one fit in? I think this one fits in if you're an Uber driver, and as an Uber driver, you're considered an independent contractor, and therefore your wages are not subject to unemployment insurance, and you have not been paying unemployment insurance. And normally you would not be able to get unemployment insurance because there's nobody out there asking for Uber rides. I think this is a method where you may be able to get unemployment compensations of up to $600 per week, even though you and Uber and no one has ever paid into unemployment insurance on your behalf. It's worth going to the unemployment insurance office and checking out anyhow. And as I've already said, the payment of principal and interest on certain federal loans have been suspended to September 30th. And you can, if you have a federally insured mortgage, and I think most of our mortgages do wind up as federally insured mortgages, you can ask for forbearance on the payments this year. And then finally, and I think this is my final one, because I want to leave time for questions here, is starting in 2020, you're able to take the first $300 in cash gifts to charity as an above the line deduction. Now, this is what happened with a tax law that was passed in December of 2017, where they doubled the standard deduction, but most people could no longer. They doubled the standard deduction, which meant that most people couldn't get their itemized deductions over the standard deduction limit, and therefore most people were switched from those people who had in prior years been doing itemized deductions, including charity deductions, could no longer qualify because the standard deduction was so high. And what's happened here is now for $300 of cash gifts, you will be able to deduct that above the line, which means that if you gave $300 to, say, Eckerd College, you would now be able to deduct that, whereas in 2019 and 2018 you were not that you didn't have the right to do it, but you could throw it into your itemized deduction, but you couldn't get your itemized deductions over your standard deduction limit or amount. It made more sense to take standard deduction. I think that's my final chart here. So this $2 trillion just got passed last week. How does the Brookings Institute say this is being distributed between us? You know, normally there's always a question, is the tax cuts always going just to the top 1%? Turns out that for whatever reasons, this one looks pretty fair. So the lowest quintile, which is the lowest 20%, this is people whose income level is 0 to 20% of the they fall in. If you listed everybody in order as to what their income level, this would be the bottom 20% of people's incomes. They get 23.4% of the money. And this would be the 20 to 40% group. They get 22% of the money that is of that $2 trillion. And then what you see in surprise and that the top 20% are only getting 11% of the money, probably primarily through this minimum required distribution thing, and the top 1% are getting zero. Kind of an interesting look at how this $2 trillion is being distributed. So we are now to the question and answer part, and we got 10 minutes to go. Can the new CARES Act save you $10,000 plus? I am open for questions.
Okay, Peter, we have one that just came in recently, and then I will go back to some earlier ones, but you had said something about a charity giving. The question is the $300 for each charity or cumulative?
Cumulative. Total amount, total cash, as I understand it. You know, I haven't seen the new rules. This has only been out a week. It's 880 pages long, and it's got to yet be turned into tax returns. But as I understand it, it's a cumulative $300. You could give 3 $100 checks or however you wanted to do it. But once you go over $300, the only way to continue to get an itemized, to get a charity deduction is to itemize your deductions, and most people aren't going to want to do this because it's better off to doing a standard deduction.
And then we've got one that says, how do you see the pandemic ending, and what is your timeline?
I thought of throwing in a chart that I've shown before, and maybe I'll do this next week, that shows the pandemic spreads by I forgot which college, which university did this, but it looked pretty well done to me. And it showed that if there was no quarantining and everybody just went on with their life the way they had been going on, that 70% of us in Florida would have been exposed to coronavirus by the end of April, the end of this month. But by putting us all into quarantine, voluntary or whatever kind of quarantine we're in, and being more careful, it showed that by the 1st of August, only 15% of us in Florida had been exposed to the actual virus and could have caught it. So what happens is, the better the quarantine is, the longer the virus hangs around. The virus burns itself out after everybody has either been vaccinated or infected. There's nobody else to get sick. And the virus is not a live organism. It passes itself on. It's going to burn itself out. So the weird thing in this is, the better the quarantine, the longer it hangs around. So how do you explain, okay, I get that, and I see how that works. How do you explain China then? I don't know how I explain China. I question a little bit their numbers, but I think they've turned around and they're giving us pretty good numbers. Well, then why, if they're starting to let people go back to work, why don't you have a rebound effect? Because some of those people must have gotten it, and unless they're doing an extremely good job of keeping those people who were infected or are still infected quarantined, and only giving the so-called green card that I talked about earlier to the people who are proven somehow that they are not infected and that they're safe to be around. I don't know how this is going to work out. We don't know whether they're going to come up with some magic drug. Now, they're not going to come up with some brand new magic drug, because a drug takes 12 years to get approval on. What they're going to have to do is repurpose an existing drug, like that malaria drug. But that one looks promising. And then if you keep people from going to the hospital, or if they're in the hospital, they recover quicker, and so you aren't overloading the hospital system. That all helps out. Boy, I wish I knew the answer to that question.
I know, we all do. Kind of related to that, there's a question that says, is there conclusive scientific evidence that someone who has recovered is now immune? Do we know?
Well, I wished you had a medical doctor on this, but my answer would be, yeah. If you've got the measles once, and or most of those childhood diseases, you either got the vaccine for it, or if you're older like I am, you may have caught them, and once you catch them, your body builds the antibodies. They stay floating around in your bloodstream for the rest of your life, waiting for the measles to show up. And when they do, they jump on that measles virus and they eat it up. So yeah, I think once you have caught it, once you have caught C19, even if it's a very mild case, and the reason it's a very mild case is your immune system has caught it, reacted to it, and killed it and eaten it up. You now have the antibodies in your system, that the next time you get exposed to it, and it's not that you're not going to get exposed to it again, but the next time you get exposed to it, your body's going to handle it. The reason we keep catching the cold every time is there's so many different versions of the cold virus that our bodies build an antibody for one cold virus, or 100, if one a year builds a new antibody, and then a new virus. Okay, so you don't get all those colds, but a new one shows up. And this is why the flu is always a problem. You're getting a vaccine for last year's flu. What happens if this year's flu is not last year's flu? It's not. You don't have the vaccine for it. You don't have the antibodies for it.
What about people with allergies? There's a question that says, aren't pollen allergies an overreaction of your immune system? Is everyone with hay fever at a higher risk?
Yeah, that is an immunity. I don't think. I mean, even if you are deathly afraid of a bee sting because it may kill you if you don't get one of those injection things, even if you were had that kind of an allergy, I think it's a different kind of an allergy. It's an immune system overreaction. And as was explained to me last night, it's an immune system overreaction. And I don't think you can base your immune system overreaction to pollen or chocolate or peanut butter or anything else. I think that the immune system goes nuts just depending. Would my guess be that you're at a slight higher probability? Yeah, but would my guess be that I would hunker down in a bomb shelter? No. And that's just guess. Talk to a doctor, but no, I don't think so. It's an option out there that if you get it and your body starts to react to it very, very, very aggressively, perhaps this malaria drug will slow down your immune system's reaction, because what may be getting you into trouble is not the virus itself. What may be getting into trouble is your overreaction of your immune system, the same way as a bee sting or peanut butter can sometimes trigger that.
We appreciate everything, Peter. Thank you very much.
Thank you. I look forward to seeing you all next week. And to be honest with you, I probably am going to be updating this, because the coronavirus it's like trying to drink from a fire hose. The new information is coming so rapidly. Okay, great. Thank you.
Thanks for joining, everyone. Have a great day.